So you're off to conquer Italy, language and all. But wait, what about the health insurance? Today, we'll guide you through all that there's to know on this topic, so that you're going to be able to navigate the Italian healthcare system like a pro, while focusing on your Italian experience. Ciao a tutti and welcome back to the Italianforawhile channel, your go-to destination for all things Italy. If you haven't done it yet, don't forget to subscribe to our channel for more tips and tricks on how to make the most out of your learning experience in Italy. And now, let's talk about the Italian healthcare system. First of all, you need to know that since 1978, healthcare in Italy has been provided through a mixed private-public system. On the public side, there's the SSN, so the Servizio Sanitario Nazionale, which provides free or very low-cost healthcare to all Italian citizens and non-citizens with residency status. Most basic services, such as doctor visits and hospital checks, are free for everyone all over the country. There may be small fees for certain services, and medications can vary in cost and coverage from region to region. Despite that, most Italian citizens and residents alike also opt for a supplementary private insurance. The Sistema Sanitario Nazionale is funded through a combined mix of income tax, which applies to everyone working in Italy, and government funding. And even if you choose to rely solely on your private insurance, if you're working in Italy, you will still have to pay for the public one. For an easy access to the healthcare in Italy, you need to have your tessera sanitaria. Now, for what concerns appointments, they can be made through regional booking services, directly with the provider, or just by calling the doctor. Of course, waiting time for certain specialists or certain procedures can vary, depending also on the region where you are, on the severity of your situation, and on the queue list of people before you. Of course, for non-urgent cases, the waiting time can often be longer. And that's why most people that can afford it decide to often also opt for a private insurance, to be able to go to private structures that often have shorter waiting times. This is of course one of the main downsides of the public healthcare system, which is often highlighted by all those people who would like to have a private healthcare system in Italy as well. Now let's have a closer look at what are the strengths and benefits of the Italian healthcare system. Let's start with the strengths. First of all, universality. The Sistema Sanitario Nazionale in Italy offers peace of mind to everyone, because basically everyone that is a citizen or that has a permit to stay in the country can get free access to it. Second, affordability, as general taxation helps to keep the cost very low for Italian citizens, allowing you not to worry about excessive healthcare costs, which is the case in other countries such as the US, for example. And lastly, continuity of care. Indeed, whenever possible, the system emphasizes building a strong connection with your practitioners, fostering trust and familiarity. The main weaknesses on the other side are the following. First of all, as we already mentioned before, waiting times. Due to the easy and inexpensive accessibility to the healthcare system in Italy, there are a lot of people also that are in not severe situations that decide to take regular checks, and so the waiting time can really become long, especially for non-severe conditions. Second downside, regional variations. Indeed, service delivery, waiting time, and also specialist availability can really change from the north to the south of Italy. It is, for example, well known that in the northern part of Italy, the healthcare system is more efficient, while in the south, most structures are very old and there's a lack of practitioners that often decide to go work in other regions or abroad. And lastly, another downside are the language barriers. Indeed, not a lot of practitioners, doctors or specialists speak English, and so if you're a foreigner, it can be hard to navigate the system. So we've almost reached the end of our journey through the Italian healthcare system. But first, let me give you some bonus tips. First of all, in case of any emergency, just know that the Italian number to call in any region for the ambulance service is the 112. Also take into consideration that contrarily to other countries with private healthcare system, such as the US for example, you won't be charged for the ambulance ride. Second, to overcome any possible language barrier that you may encounter when going to the hospital, try to memorize some very short but important sentences, such as ho bisogno di un medico, which means I need a doctor, or mi sento male, which means I feel sick. And lastly, consider that medication costs can vary, especially depending on the severity of the procedures you may need. So if you want to have extra peace of mind, just consider to purchase a private health insurance as well for your trip to Italy. And with that, we reach the end of today's journey through the Italian healthcare system. And remember, with this guide and by always being proactive and informed, you're going to be able to navigate the Italian healthcare system with no problems, which will grant you peace of mind while traveling in Italy. If you found this video useful, don't forget to like it, comment it, or just share it with your friends. Also, I deeply recommend you to join our online community. It is the perfect space to ask questions and join conversations on all things Italy. Ciao, alla prossima!